Before the break, CNN star Murray and Ryan Nobles laid out how the Senate GOP repeal and replace Obamacare bill died today and how Senate Majority Leader McConnell is hoping a bill to simply repeal the law might pass sometime early next week. Shortly before airtime, I spoke with someone who's been a critic of some aspects of Obamacare and a sharper critic of Republican plans to get rid of it, Vermont Senator and former Democratic presidential candidate Bernie Sanders. Senator Sanders, President Trump is saying that his plan is to let Obamacare fail, in his words, and that the Democrats will then come back to him. What do you think of that?
Well, I think it's really beyond belief that we have a president of the United States who is working overtime to sabotage the health care that millions of Americans receive. Anderson, the reason that this Republican bill failed is because it is something that was a disaster that the American people overwhelmingly did not want. You don't throw 22 million people off of health insurance, raise premiums for older workers, defund Planned Parenthood, cut Medicaid by $800 billion, and then give huge tax breaks to large corporations or wealthy people. That's the Republican plan. And instead of working to figure out a way as to how we can lower the cost of health care in America and provide health care to all people, take on the pharmaceutical industry and lower the cost of prescription drugs, you got a president who says, okay, let me do nothing. Let me sabotage the current system, and so what if millions of people suffer? I think that is really awful.
Will Obamacare fail if Congress or the president don't take steps to at this point fix it?
No, I don't think it will fail, but I think millions of people will be impacted with higher premiums, and in some cases, and this is not me telling you this is what the insurance companies are saying. If we don't put money into the cost-sharing program, if you don't enforce the individual mandate, substantial sums of money are not going to come into the system, which will make it a lot harder for the insurance companies. That's not me. That's what the insurance companies are saying.
So at this point, do you think you, the Democrats, as lawmakers, have a responsibility to try to work with Republicans to fix the current system?
The answer is absolutely. And that is why there are many of us who are talking about ways that we can significantly improve the Affordable Care Act. Anderson, I don't think you're going to hear anybody here say that the Affordable Care Act is perfect and doesn't need improvements. Deductibles are too high, co-payments are too high, premiums are too high, prescription drug prices are off the wall. So what we need to do is at least three things. Number one, I happen to believe we need a public option in every state in this country. If people don't get the private insurance coverage that they like or that they need, we should have a public option available. Number two, I believe that we should lower Medicare eligibility from 65 to 55. And number three, I think we should substantially lower the cost of prescription drugs by allowing pharmacists and distributors to import lower cost drugs from Canada and in other countries, and also to have Medicare negotiate prices with the pharmaceutical industry. Those are three ways that we can improve the Affordable Care Act. Longer term, and I'm going to introduce legislation to do this, we have got to join the rest of the industrialized world and guarantee health care to all people as a right through a much more cost-effective and simple system that I call Medicare for all.
But in order to do anything, you're going to need Republican support. I want to play you what Minority Leader Chuck Schumer said today about working with Republicans.
If Republicans abandon cuts to Medicaid, abandon tax breaks for the wealthy, and agree to go through the regular order, the door to bipartisanship is open right now. Republicans only need to walk through it.
A lot of Republicans are saying, well, that doesn't sound like bipartisanship. That sounds like setting conditions in order to get something done.
Anderson, the last poll that I saw on the Republican proposal had the support of 12% of the American people. The American people do not agree about throwing millions off of Medicaid in order to give tax breaks to the wealthy. I think all that Senator Schumer is saying is, hey, stop talking about tax breaks for the rich. Stop talking about massive cuts to Medicaid. Let's see how we can improve the Affordable Care Act, not destroy it. I think that is a reasonable starting point for any serious discussion.
I mean, the other thing that the president said today was that he's not going to own it. The Republicans are not going to own it. Democrats, you could say, have also engaged in their fair share of the blame game. Shouldn't people's health care take precedent over, at this point, scoring political points?
Well, I certainly think that it should. But let us remember the political reality of today. Last I heard, the president was a Republican. The Republicans had majorities in the House and the Senate. They controlled the United States government. So of course they're going to have. Those are just silly words, and you're right. We should not be worried about who is owning it. There's enough blame to go around on both sides.
Senator Sanders, appreciate your time. Thank you.
Thank you very much.
Well, when we come back.